Great day, everyone. We are Team 6, and today we have a very interesting topic to present to you. I will get it started, and my teammates will follow along. Stay tuned. The concept of employee wellness has been around for centuries. Nevertheless, wellness programs began in the 1950s with the advent of Employee Assistance Program, or EAP, when employers started to offer targeted support for alcoholism and mental health issues. Employee wellness programs, as we know them, began in the 1970s when healthcare responsibility shifted from government to employers. In the 1980s, companies began focusing on mental health instead of just physical wellness, which was done primarily by the EAP. In the 1990s, the U.S. Department of Health and Human Services released the first of a series of Healthy People Report, which proposed that 75% of employers with 50 employees or more offer health promotion services to improve the lives of Americans. Wellness programs or benefits provided by employers to improve or promote well-being of employees. They are created with different aims which depends on organizational goals, including weight loss, smoking cessation, nutrition education, and using countless other formats. Incentives can be provided to encourage participation. They can be offered through health insurance or third-party vendors. Notable early adopters of wellness programs include Johnson & Johnson in 1979 with their Live for Life wellness program, which was the model for corporate worksite program at the time, and Boeing in the 1980s with smoking cessation. Many factors drive the development and sustainability of wellness programs. For our employers, cost containment is the main reason, as research has shown that the programs can lead to substantial savings on corporate healthcare costs and also worker compensation costs. For employees, they include reduced health risk and stress and reduced medical costs. Wellness programs offer many benefits, including reduced turnover rate and absenteeism, improve employee morale, increase retention, increase productivity, reduce healthcare costs, reduce work injuries, but they also come with challenges. They can be costly to implement and sustain, and they can lead to compliance and legal issues. Since many organizations like Walmart, state government, and countless others use third-party vendors, employee data can become compromised. For example, in 2012, Stay Well, which is a health management program, had to notify more than 10,000 participants of the wellness program Eat for the Health of It or Stress that their data had been hacked because they were stored in a publicly accessible folder. In 2014, hackers accessed data from 4,500 employees participating in the Huntington Bankshares Wellness Program, also managed by Stay Well, which were stored in an online scheduling application for health screenings. AARP sued the wellness program for Yale University in 2019 because it violated, according to them, Genetic Information Non-Discrimination Act, or GINA, and the Americans with Disabilities Act, or ADA. And also, experts fear that employers can gain access to those types of data and use that to make discriminatory workplace decisions. So although they can offer many benefits, they should be implemented with utmost caution.
We would like for you to know companies with amazingly unique wellness programs. Let's start with Fitbit. Staff are categorized into different tracks like pregnant, nicotine positive, high BMI, or healthy conditions. To name a few, that each wellness programs can be personalized, tailored. This is where Fitbits can come into good use, as employees who complete their track successfully earn a premium difference of $520 on an annually basis. Let's talk about Google. The campus has a slide in case employees are tired of taking the stairs. The East Coast office houses ping pong tables, nap pods, and let-go stations. Employees can shower, get their laundry done, get massages, and even swim at work. At the Motley Fool organization, health is in Earth-friendly products DNA. The company is a champion in the green sustainable world and thus strives to create an office community that mimics that. In fact, each facility has an organic garden from each employee can snack fruits and vegetables. At Zappos, they play hour-long golf lessons, laser tags, or trampolining. Also, to kick off March Madness, the company organized a 3-on-3 basketball game in the Zappos Outdoor Plaza. getting people from all departments to watch.
In preparing your company's wellness program, one needs to consider how HIPAA privacy and security rules work. Both rules are implemented to protect employees' identifiable health information known as PHI, which is collected and held by covered entities and business associates. Covered entities are defined as health plans, healthcare clearinghouses, and healthcare providers who electronically transmit any health information in connection with wellness programs for which the Department of Health and Human Services has implemented. Under the HIPAA security rule, business associates generally are entities that perform functions on behalf of a covered entity which have access to PHI. HIPAA privacy rule requires covered entities to implement protections and prevent unauthorized use or disclosure of PHI. HIPAA security rule requires covered entities and businesses associates to implement administrative, physical, and technical safeguards to secure electronic PHI. HIPAA also protects PHI that is held by the employer as plan sponsor when the plan sponsor is administering aspects of the plan, including wellness program benefits offered with restrictions without written authorization of the employee. If the workplace wellness program is offered directly by a non-covered employer, for example, Amazon, the health information that is collected is not protected by the HIPAA rules. However, other federal or state laws may apply and regulate the collection and/or use of the PHI. When a covered entity has knowledge of a breach of PHI as an unauthorized use or disclosure that compromises the privacy or security of the employee's PHI, the covered entity under the HIPAA rules must notify the individuals, the Department of Health Human Services, and if applicable, the media in accordance with the requirements of the HIPAA breach notification rule. The federal agency that enforces HIPAA is the Office of the Civil Rights under the United States Department of Health and Human Services, known as OCR. They are responsible for enforcing HIPAA privacy and security rules by investigating complaints filed, as well as conduct compliance reviews to determine if covered entities are in compliance, and they perform education and outreach to foster compliance with the requirements of the privacy and security rules.
As Janet previously mentioned, wellness programs can be affected by data breaches. When the organization or third-party providers are not a covered entity under HIPAA regulations, we have to be aware of the confidentiality and identifiable information that a person gives to wellness programs. For example, let's take weight loss wellness programs and employee assistance programs. We can ask ourselves how companies and platforms such as Fitbit protect the information a person provides. When does this platform that helps us regulate our exercise become a diagnostic tool? And the person using this under a wellness program seeks medical advice. Should this therefore be regulated under HIPAA? And if this platform is not a regulated entity, are they allowed to share the results to their employers? Most third-party vendors are for-profit and therefore not considered a health entity, which means much of the information their program collects is a legal gray area because they are not protected under HIPAA and could potentially sell health data information without informing employees, therefore risking employees' private data and creating legal liabilities for employers. Organizations need to be aware of whom they contract and if HIPAA applies to them to be able to protect their employees. When it comes to vaccine programs, such as COVID-19 vaccines and flu shots, companies need to be aware that under ERISA, vaccination is medical care. And if you as an organization are incentivizing employees, you need to be aware that under ERISA, there could be compliance obligations. Programs must also comply with the rules and regulations published by HIPAA and are subject to their non-discrimination rules. The vaccine incentive program has to comply with HIPAA's limits on incentives, and consequently, employees who cannot receive the vaccine due to adverse health factors
must be provided a reasonable alternative method for earning the incentive, if the organization is providing one, for getting vaccinated. Consequently, this directly correlates to ADA, because if an employer is offering a vaccine or even contracts a third party to do so, they must comply with wellness programs rules. ADA applies if the person taking the information inquires or requires any medical examination and pre-screening questions that can be related to disability questions, just as if the organization asks why a person did not get vaccinated, this inquiry is subject to the ADA according to the EEOC. If they do have to ask this, it has to be as a part of a reasonable alternative standard under HIPAA, and therefore said incentive has to comply with ADA's voluntary wellness program rules. Finally, GINA applies to wellness programs because organizations should be aware that pre-screening questions should not include genetic information questions.
A wellness program should be accessible to all full-time employees, as previous research shows that the health status of employees directly influences their work behavior, attendance, and on-the-job performance. Therefore, improving employee well-being will result in a more productive workforce. Ideally, a wellness program should be a natural extension of a company's values and objectives, with potentials to strengthen an organization's culture and to build employee pride, trust, and commitment. Because personal health is such an intimate issue, investment in wellness can, when executed correctly, create deeper bonds between employees and employers. Confidentiality is important to maintain privacy, security, and trust in employee-employer relationships. It is valued and expected in any situation where sensitive information is accessed or is shared, including in wellness programs. If your company values confidentiality and privacy, it is suggested you keep all wellness program information confidential. As previously mentioned and discussed by my teammate, many companies like Fitbit, Google, Motley Fool, and Zappos have the most desirable and intriguing wellness programs for potential employees. External competitiveness is beneficial to a company looking to start a wellness program because you are able to compare, learn from competitors' mistakes, and see what's out there that is attracting employees. How will your wellness program help you stand out from your competitors? In comparison to a company that does not have a wellness program, the pro of working for a company with a wellness program is unmatched. There are sources of wellness that an employee might have not ever considered. For example, know what your company purpose is for wanting to implement a wellness plan. Learn from the errors of your competitors. Promote your wellness program as what it is, a benefit. Learn to motivate your employees. Praise their wellness and use of the wellness program. How will your wellness attract top performers? In today's world, potential employees, while incentivized by salary, are definitely wooed by great wellness programs. And according to Forbes.com, employees with a wellness program in their corporation are less likely to leave their positions and move elsewhere. An employee, like any normal human, likes to feel valued and cared for, especially by the corporation that they put so much of their time and hard work into every day. Protecting employee health information should be the first thing that is discussed when trying to implement a wellness plan in your corporation. Many employees might be easily convinced that saving a couple dollars in their insurance plan or getting X amount of money as a bonus is them being fully informed on what they are agreeing to when accepting this incentive. The fine print of the agreement that comes with the incentive should be fully disclosed to the employee, in addition to anything that can be done with their health information. Addressing any privacy concerns should be a key question when attempting to getting more employees interested in your wellness program. When privacy concerns are addressed, there is more likelihood that employees will feel comfortable and more willing to participate. An employer must ensure that health screenings do not violate the Health Insurance Portability and Accountability Act, also known as HIPAA, or the Genetic Information Non-Discrimination Act, also known as GINA.